Pediatric patients in the hospital setting are often subjected to many routine procedures such as intramuscular injections, subcutaneous injections, intravenous insertion, and catheter insertions. These routine procedures can cause pain and increased anxiety and distress, especially for patients in the pediatric population.
Although the use of topical anesthetic creams can help reduce procedure-related pain, these creams can take up to an hour to become fully effective. However, the use of distraction for pediatric patients has been shown to also be an effective technique to manage pain and anxiety during procedures.
Evidence-based practice shows that the use of physical distraction strategies in combination with pharmacological and psychological strategies can indeed promote lower levels of anxiety, distress, and pain in pediatric patients. Various distraction techniques exist and can vary with the age, temperament, and interest of the child, but the effectiveness of these various techniques is well supported.
Researchers have found that the most accurate measure to use when assessing pain is the Wong-Baker-Faces Pain Rating Scale. This scale is very useful for patient demographics such as pediatrics because it allows them to have an easier way to describe their pain. This scale helps by giving people who may not understand the basic 0 to 10 pain rating system alternative ways to comprehend the scale. It does this by assigning a different face illustration as well as phrases such as no hurt to worst hurt to each degree of pain on a printed chart that the patient can interact with.
Good pain management is a vital component to ensure that the dignity and autonomy of the patient is promoted and protected. It ensures quality care is given to all patients regardless of their age. The use of drugs alone is not always sufficient for pain control management. This is why a non-pharmacological treatment is also recommended to help shift the patient's attention to something else. The use of distractive techniques is a useful intervention strategy to improve the emotional impact and reduce suffering in young patients. At the same time, it guarantees the right not to suffer.
Both active and passive forms of distraction can be used effectively with pediatric patients. Active forms of distraction actually promote a child's involvement in an activity during a procedure. Using this form of distraction requires the pediatric patient to actively engage in the activity, which often involves several sensory components. Some of the most commonly used methods of active distraction in the clinical setting consist of interactive toys, virtual reality, controlled breathing, and relaxation. Passive distraction techniques require the pediatric patient to remain calm and quiet during a procedure. Using passive distraction, the patient observes an activity or stimulus rather than actually participating in an activity. Auditory and audiovisual techniques are the most common forms of passive distraction used with pediatric patients and often include either music or television.
Distraction is a simple technique which does not require any specific training and can be implemented by nurses, parents, or other health staff members. While focusing his or her attention on something other than the pain, the child manages to limit the analgesic perception of pain, thus reducing anxiety and fear.